In the name of Allah, the most merciful and the most gracious. Assalamu alaikum, dear students. I'm your course instructor Ratiba Muzammil, and our today's topic is disorders of the reproductive system. That is the last topic of chapter number 20, reproduction. So first of all, we need to know the definition of infertility, that is the disorder of the reproductive system. It is the failure to achieve pregnancy, or in other words, infertility cannot be defined precisely because there are varying degrees of the infertility. And in this session, we will talk about the causes of female and male infertility, their treatments, and different diseases of the reproductive system. So there are basically 6 types of female infertility. First one is failure to ovulate, then blocked fallopian tubes, uterus damage, cervical mucus defect, endometriosis, and anti-sperm antibodies. We will talk about them one by one. So first of all, failure to ovulate. This is because of the hypothalamus or pituitary gland that sometimes fail to produce hormones normally. For example, if there is no follicles development, that usually happens because of follicle stimulating hormone, or the egg may not be released, or the egg release is affected, and it is because of the lack of luteinizing hormone. Second type of female infertility is blocked fallopian tubes. In some females, the infertility is due to tubal disease or the damage that is caused by the blockage of the fallopian tube. It may also occur due to some infections. Third one is the uterus damage. Sometimes the benign or non-cancerous tumors, they grow in the walls of the uterus that may become the cause of the infertility. And these benign tumors are called fibroids. Then comes the cervical mucus defect. During ovulation, mucus in the cervix becomes very thin, which cannot hold the sperms which are swimming through it, and it becomes more easy for them to go. If there is a problem with the mucus, it makes it harder to conceive. Endometriosis is a condition where small pieces of the endometrium starts growing in other places, for example in the ovaries, and this can cause infertility because the new growths make it difficult for an egg to be released and to become implanted into the uterus. The third type is anti-sperm antibodies. This is the rare form of infertility, but the women who are having this problem, they produce antibodies against their husband's sperms. Then second topic is causes of male infertility. The common causes of male infertility are azoospermia, oligospermia, sperm deformities, and autoimmune disorder. Azoospermia is the state of having no sperms, and it is the cause of about 5% of the male infertility. This type of infertility may be caused if sperm ducts are blocked due to any infection or some injury, or the blockage may be congenital, that is, it is because at the time of the birth. Second type of male infertility is oligospermia. It is the state of having very less number of sperms, and more than 90% of the male infertility is due to the less sperm count. Sperm count that is below 20 million per ml is called oligospermia. The third type of male infertility is sperm deformities, and according to its name, there is a change in the shape of the sperm. It is called sperm deformity, that is, the sperm may have two tails or no head or any abnormal shape. Lastly, the autoimmune disorder. In some individuals, infertility is probably due to an immune response by the male to its own sperms. Antibodies are made which attack the sperm and reduce the sperm count, which ultimately result into this male infertility. Gynecology is the specialty of medicine that is concerned with the dysfunction and diseases of the female reproductive system. For example, if a person or a woman who is having any disorder related to the reproductive system would consult a gynecologist. Then we will talk about the treatment of the infertility. A number of treatments are available, out of which the in vitro fertilization is the most important. Another treatment for the infertility is hormone treatments or the surgical treatments, etc. In vitro fertilization or test tube baby technique. In vitro or glassware fertilization is the most effective type of assisted reproductive technology, and it is the very developing technique of fertilization. It is often used when women's fallopian tubes are blocked or when a man produces too few sperms. This is commonly known as the test tube baby technique, and this technique involves fertilizing one or more eggs outside the body and then transferring them into the womb of the mother. When they have become fertilized eggs, and they are known as pre-embryos. So in this technique, ovary is stimulated to produce eggs by giving a drug which is having fertility hormone, that is FSH, to produce several eggs. Then eggs are collected from the follicle by sucking out the fluid contents of mature follicles with a fine hollow needle which is inserted into the abdominal wall under general anesthetics. On the other hand, sperms are collected from the male partner and they are washed in a culture fluid to remove the seminal fluid. Then the process of fertilization would occur in a glass dish or a tube. About 1 lakh healthy sperms are added to each egg about 6 hours after egg collection. This is done in a glass dish or in a tube. The fertilized eggs are grown for about 2 days. And when they become at a stage of 2 to 8 cell stage, after the examination, these embryos are transferred through the cervix into the uterus, using a fine plastic tube. Then the progesterone is given to the female to promote favorable uterine environment for the implantation of the embryos. Coming up to the next topic, that is miscarriage. It is the act of giving birth spontaneously to a fetus that is too premature to survive, and this usually happens before 28th week of the pregnancy. The causes of the miscarriage is that the embryo may implant near the cervix, and in this condition a placenta grows that may extend partially or completely across the internal cervical opening. As the fetus and placenta continues to grow, the uterus stretches and the region of the placenta over the cervical opening may be torn and a hemorrhage may occur. Secondly, in the normally positioned placenta, that may also tear away from the uterine wall, accomplished by hemorrhaging. Both of these conditions may result in miscarriage and also be life-threatening for the mother. Premature birth or expected date of delivery, when it comes early, is a state in which the birth is given but the baby is able to survive. It is not called miscarriage. Now we have to compare the miscarriage and abortion. The term abortion is usually referred to the induced premature termination of the pregnancy, and this is because of some genetic defect which have been seen in the fetus. So it is induced by the physician, and medically speaking, a miscarriage is a natural abortion or a spontaneous abortion. Next topic is the sexually transmitted diseases. Sexually transmitted diseases are contagious and they are caused by the pathogens which are passed from one human to another by the sexual contact. The STDs may be caused by viruses and bacteria. Gonorrhea and syphilis are caused by the bacteria. Today we will talk about AIDS, that is acquired immunodeficiency syndrome, and it is the most seriously and deadly disease in the human history. AIDS is caused by human immunodeficiency virus or HIV. And if the person get caught in this kind of disease, the HIV or human immunodeficiency virus destroys all the helper T lymphocytes, which are the major components of the immune system. Therefore, the people who are having or who have been infected with HIV, they begin to get serious infections. The spread of AIDS is because of the sexual contacts, infected syringes, and blood transfusions. The worldwide infection rate is 36.7 million people living with HIV or AIDS. They were counted in year 2015. And about 35 million people have died from AIDS-related illness since the start of the epidemic till 2015. And every year since 2010, around 1.9 million adults have become newly affected with HIV. Now, what is the control of STDs and AIDS? The sexual contacts should be avoided. The routine testing for HIV can prevent transmission through the blood transfusion. The barbers should be asked to always use new blades and towels. Use of the disposable syringes can avoid transmission of the virus by the needle. The hygienic conditions should be adopted, and its treatment involves medication for a long time except the AIDS. Thank you so much.